Hello, good afternoon, everybody, and welcome to our webinar this afternoon. Great to see so many of you again from a wide range of providers, NHS, private GPs, dentists, care homes. Welcome to you all. For those of you that haven't joined one of our webinars before, my name is Dr. Claire Sieber. I'm a practicing GP based down in West Sussex, and I run the Well-Led Provider with a team that you will meet shortly. This is the fifth in our CQC Well-Led series of webinars. Each webinar has been focusing on one of the quality statements that sits under the Well-Led key question. And today we're looking at the quality statement called Governance, Management and Sustainability. And it seems to be the most popular one that we've run so far. All of the recordings for our previous ones are on our YouTube channel, and we'll send you the details of that afterwards. And we will also send you the details of the recording to watch, even if you haven't joined the webinar today live. And we'll also then in those details send you the details of how to access the slide deck, so you don't need to make lots of notes. Some of the slides are quite text heavy because this is CQC and compliance, so we need to be sending them to you afterwards. We don't expect you to copy it all down. And we're having a little break over the summer. We've been doing one of these every month, but it's summer now, so everything stops, and we'll be resuming these webinars again come September. If you have any questions, do try and put them in the chat button, and we'll try our very best to answer them either as we go by replying or at the end when we come to the Q&A. You can also ask questions afterwards if things come up in your mind when you're rereading the slides or watching the webinar, and you can do that by just filling in our feedback form where there's an option for you to ask us questions, and then we'll get back to you by email. So what are we going to cover today? Let me talk you through the format. We'll introduce you to this new quality statement of governance, management and sustainability. Gabby, our CQC expert, will then talk you through what that actually means and unpick it a little bit. And in that unpicking, she'll give you evidence from recent inspections of care homes and GP practices of what seems to be ticking the good box or the inadequate box or the requires improvement box. So you can either do the same or make sure you're not doing those. And then we'll put our providers of our panel in the hot seat, so Gabby can give them a little bit of a grilling. And then at the very end, I'll talk to you about the Well-Led Provider platform and how that can help you in terms of making sure you're ready for the CQC when it comes to the Well-Led key question. And as I said, we'll do some question and answers at the end. So I've already introduced myself. I'll let Gary introduce himself next, and Ketan if he's on the call, and then we'll hand over to Gabby to introduce herself and take you through the majority of the presentation today. Thanks, Gary.
Hi everybody, yeah, good to be back on another webinar. So I'm Gary Hughes, I'm part of the Well-Led team. I've had 15 years in primary care, 13 and a half of that as a board of a PCN and one of the founding directors of a federation, and I now support practices, PCNs, federations in a variety of different ways.
Thank you, Gary. Ketan isn't on the call, but Ketan is one of our GP partner colleagues who very recently had a CQC inspection. He's also a mediator and wears various leadership hats like many of us GPs do. And he'll hopefully be around towards the end of the webinar to take some of those hot seat questions from Gabby. But why don't I hand over to you now, Gabby?
Great, thanks Claire. Thanks everyone for joining. It's lovely to see so many people here today. So for those who haven't met me at the previous webinars, my name is Gabby Ashton and I've been working across health and social care for probably about 15 years as well now. And more recently I was a CQC inspector for about 4.5 years, so supported in adult social care and in the primary medical sector as well, so independent GPs and in the NHS as well. So yeah, lovely to meet you all, and we will go straight into the reports. So for those of you who have been on the webinars before, what we tend to do is look at the data that's being published on the CQC website each month, and then we're also keeping a running total of the data across the year. We did have a question after the webinar last time about how this data is captured, and so I just thought I'd shed some light on that. The CQC publish reports throughout the month. So yeah, so any day across the month there is the reports are being published. The best time to look, if you want to have a look at data for a period of time, is on the last day of the month, because the following day, so the first day of the next month, it will all get refreshed. So all of this data that we're looking at now on this slide was captured on the last day of May, and then in a few days, well, about a week and a half, I'll then do the same for June, July, August, etc. onwards. So if you had a look today, for example, 18th of June, you might see very different numbers to what you'll see on the next webinar or what you'll see at the end of the month. So if that's something that you're looking to do yourself to build a database, then always just set a reminder for the last day of the month in your diary, and that will help you. So we can see kind of a typical trend that we're seeing from the previous webinars is that the care homes or residential services are being inspected and reports are being published at a much higher rate than GP practices for various reasons, and we can see that the outstanding services are remaining incredibly low. Unfortunately for GPs, there were no outstanding services published in the month of May, and there was just one care home that received that rating. You can see quite a difference in the requires improvement and inadequate across the GP practices versus the care homes. Nearly 90% of the GP services were facing regulatory breaches or recommendations of some sort, which is obviously incredibly high. So hopefully for those partners on the call today, there'll be some value and support with understanding some of the common pitfalls that the CQC is seeing. And yeah, great to see so many good services in the care home sector as well. So this is a snapshot of 2024 so far. As I said, we'll continue to count these up over the summer, even while the webinars are on pause, so that when we do rejoin again in the autumn, we'll have a clear picture of how the year has looked. So yeah, keep an eye out for that. And we will now move on to governance, management and sustainability. So the fifth of the quality statements under the well-led key question. So this is the CQC statement here. So you, the providers, have clear responsibilities, roles, systems of accountability and good governance. It's a mouthful and it's a lot to take in, probably why this one is the most popular, as Claire has mentioned. So you'll be using these to manage and deliver good quality, sustainable care, treatment and support. You will act on the best information about risk, performance and outcomes, and you will share this securely with others when appropriate. So we just really quickly on this. So when we're thinking about what good governance is, and obviously there's a huge amount that we could talk about today, we're going to do a bit of a deep dive into one of those particular areas, which is roles and responsibilities. But when you this isn't necessarily on the slides, but when we're thinking about what good governance is, there are 5 areas that I tend to. So if we can just go back to the last slide, Claire, sorry, the previous, thank you, perfect. Yes, there are 5 areas that I tend to advise providers on what is good governance when they're asked, or when we're discussing this as part of our mock inspections. So if anyone's got a note to hand, otherwise you'll get these slides afterwards. But the first one is thinking about policies and processes, and always making sure that these are informed by your strategic direction and in line with legislation and best practice. So time and time again, we will see policies that exist, but if they haven't been updated, if they don't reflect the current guidelines, then they're essentially useless. So we need to think about always making sure that they're up to date, and also making sure that they're informed by the provider's strategic direction. So again, we'll often read policies or procedures or processes that are quite generic, and then when we do a deep dive, we meet with the registered manager, we meet with the NI, we meet with the clinical lead. They're actually working in a completely different way to what their processes say. So making sure that they're informed and reflective of how you're working is really important. It sounds obvious, but it's important. Then I like to advise on structures for optimal performance. So this will include making sure that you have clear roles and responsibilities, with accountability being well managed. So we'll dive into this later, but as we all know, the practice manager, the registered manager, the clinical lead, it's a huge amount of responsibility to take on to get good governance right. So we do like to have a look and make sure that other people within the practice or within the service or within the care home are really clear about what their roles and responsibilities are, and that this is being well managed and overseen properly. Then we want to look at the mechanisms and the systems that you've got to ensure compliance and effectiveness. So here we're thinking, when I say mechanisms and systems, we're thinking about the audits that you have, we're thinking about the risk assessments that you undertake, anything like your digital software systems, are they fit for purpose? You know, again, especially in care homes, I know there's a huge push and there's some key players out there, some big providers that we're seeing a lot of. What can often be frustrating is if you procure something without doing your research or without including the team in that procurement process, and then finding out that it's not actually fit for purpose for your service. And so you're having to create audits or notes around something that doesn't really work, rather than with something that's been built to hopefully support you and enable you to get your governance right. So we're looking for positive and well-working digital software systems, and any other method that you use to record. If you don't worry, if you're a care home on the service that's only got, you know, paper sheets, that's absolutely fine, but we're looking at the recording mechanisms that you have as well. And then the last part to governance that I always tie this off with is the analysis and the continuous improvement. So anything that you are recording, capturing, considering, risk assessing, anything like that, you need to be able to then analyze it and then demonstrate that from the results of that analysis, you're driving continuous improvement, and always making sure that your stakeholders, so your patients, your colleagues, your local community, that all of their best interests are in the heart of any decisions that you make. So that would be my governance in 5. This here is just a breakdown of all of the different elements that the CQC have included in this quality statement. A little bit overwhelming when you look at it like that. There's a lot to think about, but like I said, we'll do a deep dive into particular areas today, and then hopefully if you have any other questions you can come back to us. So from a regulation point of view, it's always really important, as we've spoken about before, to draw anything back to the legislation. Yes, we have the quality statements that have been introduced, and they're a replacement of the CLOEs that we were very familiar with in the past, but underneath all of that, we must always hold on to the fact that the regulations haven't changed. So from a fundamental standard perspective, the expectations are still the same. And within this particular quality statement, the key regulations are 17, which looks at good governance, obviously, and then regulation 12, which talks about safe care and treatment. We've also got there on the right-hand side the notifications that you're required to send to the CQC should any of those things happen. Now, there are obviously some differences that hopefully we'll know between NHS services and residential services or dentists and other providers, but fundamentally they are the notifications that are required for the CQC. So if anybody needs any help deciphering what does and doesn't apply to you, then please reach out afterwards. So here we have so under each of the quality statements, just to make it more fun, there are then also subtopics or sub-statements. So within quality statement 5, there are also then 5 parts to it. And what we do during these webinars is we have a look at some reports that have been published recently under those particular quality statements and under those parts, and we pick them apart a little bit. So just for reference, anything that's in orange suggests is it from a requires improvement service? Anything that's green is good, red is inadequate, and blue is outstanding. So we've got 3 examples here from a service that received a score of 2 under well-led. They did actually have a score overall of good, but the well-led scored a 2, which is a requires improvement in this particular area. So this is a big one. This is looking at effective governance, accountability, roles and responsibilities, and then making sure that managers, particularly the registered manager, is able to account for the actions and performance of their staff. So we can see here an example from the CQC that although there were named leads in place for key areas, staff were clear about their roles and responsibilities, and staff did tell us they could provide feedback and had opportunities to raise concerns and to suggest new ideas. So that sounds good on the surface, but actually when we dive deep into it, the other statement beneath was also included. So this here says that although we were assured by staff, speaking to staff and reviewing the clinical system, that medicine alerts were being appropriately actioned. So this was linked to people thinking they've got a clear understanding of their role and responsibility, but there was no monitoring overview of these. So it was then difficult for staff to recall what action had taken place for historic medicine alerts, or how they monitored any changes made and how they'd been maintained. So we can see here that although when the CQC is speaking to staff and they're understanding the processes, that there are named leads in place and that they feel comfortable to raise any feedback, provide any concerns or suggest new ideas. When they did a deep dive into a very specific area, that's where the shortfall was, and that's why they then received a requires improvement rating. So that's quite helpful to think about, especially from a management perspective. You can sometimes think you've got a nice system in place and you can think that it's working and you can potentially not worry about it for a period of time, but actually you need to then be able to have full oversight and be able to do deep dives into those particular areas. So if we look at part 2, this here is looking at the systems required to manage current and future performance and risks. So this is really about risk management and the quality of the service, and to be able to take a proportionate approach to managing that risk, which allows new and innovative ideas to be tested within the service. So positively, we can see here a good example. So staff members told us there was a friendly and supportive environment to work in. Managers and GPs were approachable and staff felt supported by the whole team. And then they commented positively on the opportunities to learn and develop and that their ideas were welcomed. So that here, when we're thinking about within this quality statement, the CQC are putting slightly more emphasis this time around on having an opportunity to be innovative, to be creative, but also to be proportionate. So the fact that staff have been able to confirm that that's happening is obviously a positive from a governance perspective. And then there's a requires improvement above. Again, it starts well, so there were effective arrangements for identifying, managing and mitigating risks, but there was the exception of a risk assessment for one emergency medicine not stocked. So it might feel disproportionate, it might feel, ouch, there's lots of effective arrangements in place and everything's going well, but if they find one thing that's not, then there's no reason why they can't bring that down to a score of 2, particularly in an area obviously related to emergency medicines. So it is making sure that all of your circles are joined up. Part 3 of the quality statement is looking at data or notifications being submitted to the external organisations as required. Not much on this because you either do it or you don't, to be honest. You either know what you have to submit and you do it, or the CQC will find out in various ways that you don't do it. They might find out prior to an inspection, which could be a reason to trigger an inspection, or they might be on site and looking at different audits, different records, speaking to staff, and then saying, oh, actually, we haven't had a notification for that. Let's find out why. So yeah, here staff were aware of the processes to raise significant events and were encouraged to do so. And again, it's just making sure that from a regulatory perspective, you're submitting the relevant notifications to the relevant regulatory bodies, be that your local authorities for safeguarding, CQC for the incidents, DBS if you've got any performance management issues that reach the threshold for making them aware. So yeah, that's quite a straightforward one for people to get their head around, hopefully. Part 4 is looking at robust arrangements for the availability, integrity, confidentiality of data, records and data management systems. So essentially, are you managing data securely and appropriately? And then making sure that the information is used effectively to monitor and improve the quality of care. So what was interesting here, actually, when I read through a lot of the reports, both for care homes and GP practices, that the CQC love a team meeting, it seems. So practice meetings, all staff attended the monthly practice meetings, and that was the forum where significant events were analysed, complaints and performance was discussed, communication was effective, organised and structured. And then we can see here team meeting minutes evidence the use of data to monitor and improve performance. Leaders spoke positively about how the organisational governance review had helped to determine responsibilities for things like managing safety alerts and managing more effective performance monitoring. So it might feel a little bit underwhelming when a CQC inspector says, have you got your team meeting records? When was your last practice meeting? How do you all get together and share information? I know that I've probably asked that question 100 times this year already, but it is important that the CQC feel assured that you are sharing information in a way where you are all brought together or at least all included in the message, whether that be, you know, emails that are sent out afterwards, recordings of the team meetings are done instead of if you can't make it face to face, making sure that they're minuted, and then making sure that any actions that are set are clearly followed through. There's nothing worse for an inspector than reading a meeting with some minutes that don't have any clear actions, and then 3 months later you all meet up again and read the minutes in the meeting, and then realise that nobody's done any of the actions. So trying to think about ways that work for you is really important. Obviously, this, you know, these show quite a one approach, but there are other ways to make that work, and we want to hopefully support you to find the best way to make that work for you and your team. Again, with care homes, appreciate it's difficult with things like if you've got night staff, agency workers, in GP practices, if you've got locum staff that are coming in. So yeah, if we can help you kind of think creatively about that, then please do reach out if that's an area you'd like some support with. And then last but not least, we've got part 5, which is looking at leaders implementing relevant or mandatory quality frameworks, using recognised standards, best practice or equivalents to improve equity and experience for people using the services. Again, quite a large statement to get your head around. This is really thinking about the frameworks that you have from a quality assurance perspective and how they then essentially improve the outcomes for people with the knowledge of who your local community are, or who your partners are, who your stakeholders are, who your workforce might be. We did speak a little bit about this in the last webinar, actually, from an equality and diversity perspective. So this is really looking at it from what do you do with that knowledge and with your quality framework to then improve outcomes for people. So we can see here leaders were aware, so this is for a good service, leaders were aware of the work and any improvements required to maintain and improve the level of care and treatment for patients, and that the governance and management of partnerships and joint working arrangement and shared services promoted interactive and coordinated person-centered care. So that's a really nice one to read, actually, when we think about partnership working, especially in adult social care, and how they can work closely with their GP partners or with their local healthcare providers for various things, and really thinking about how a service understands what the people they're providing support for need. How do you know what they need, and how are you then going to meet that using good quality assurance frameworks, essentially? So yeah, a bit of a tricky one, but hopefully that's clear. So just before, well, we're going to spend a little bit of time now just looking at one of the particular quality statements. So we spoke earlier, I think it was part 1. Yeah, it is part 1 about roles and responsibilities. And the on the Well-Led Practice platform that Claire will talk about later, there's a wealth of resources and best practice guidance. Is essentially a library for you to dip into and pull out some best practice tasks, actions, plans, anything that you'd like to help you. So one of the things that that I've kind of just found through that platform and used with other providers is looking at it's called the RASCI model, so the RASCI. It's an acronym, and that helps you understand how to get roles and responsibilities right. So if that's something that you're struggling with within your practice, then I would definitely recommend having a look at that. And like I said, you know, when we hear from Claire later about the platform, then it's something to consider. So today we're just going to really quickly, because I'm very aware of time, have a look at the who, the what's, the when, the whys, the wheres, the hows of managing roles and responsibilities. So if we have a look here. So when we think about Regulation 7, I didn't touch on this too much because this is the Regulation 7 links to the role and requirements of the registered manager. But there is really clear guidance on what you as the registered manager are required to know and to understand. So it quite clearly states here that you will bear ultimate accountability for most of the final decisions and the way that they turn out. But you want to be sure that everyone is clear about their own roles and responsibilities. So this is a fine balance between taking ownership but also delegating. It says here that that people who use services must have their needs met, And this is because providers who comply with the regulations, aka the registered manager, will be of good character, will be able to properly perform tasks that are intrinsic to their role, and have the necessary qualifications, competence, skills and experience to manage the regulated activity. So if we've got any RMs on the roll, it's really important that you understand what it means to be a registered manager, even from a regulatory perspective, and how you do have to find that balance between bearing ultimate accountability and having responsibility for the final outcomes of anything that happens across the workforce, but also understanding that you can't do everything, and so you have to be able to delegate appropriately, and how that will look in practice. So if we'll skip this slide actually, because everyone will get it. This is just some highlights from the regulation, and we'll go to this one. Thanks, Claire. So the RASCI model here, you can see at the bottom the acronym. So it encourages you to have a conversation with your workforce about who is having an understanding of who's responsible for making sure the work gets done, who's accountable for the results and outcomes, who provides support with resources, who must be consulted and who must be informed. So they're all very different roles that are required to undertake any task or any situation that you're faced with. Some key tips when you think about getting roles and responsibilities right. So making sure your job descriptions are robust. Again, many inspections I've seen where job descriptions haven't been updated for years, or they're a copy and paste job from maybe a previous place that you may have come from, or you're recruiting and actually the role has changed slightly, but you're using an existing JD. That can often be the beginning of the downfall. So making sure that you're happy with those, and that the person who's obviously taking on the role is happy with them, is important. Making sure they're always regularly reviewed. So this can be done during appraisals. That's quite a good opportunity to get those done. Obviously, we know that in every job description there's always a caveat at the end that says "and anything else." So be sure that there's movement within those job descriptions to allow for work that overlaps. But you need to be able to balance this wiggle room with an understanding of what soon becomes out of scope for that particular person and for their capabilities, their skills, their qualifications. You know, it can be very frustrating to see people that are leaned on inappropriately within a service, just because that's just what they're required to do, but actually it's not necessarily what they're able to do. So it's really important to think about that. So if we go to the next slide, you'll see here how you can use this model. So I've just made up 4 people in a GP surgery, and then I've had a look at the different elements that you might be thinking about. So managing your appointments with the doctors or with the nurses or any clinician, thinking about sales and marketing. You might want to think about human resources, your health and safety, clinical compliance, and then non-clinical compliance. So those are your governance add-ons, things like complaints, safeguarding, compliments, anything like that. So probably better when you have the two slides in front of you, because you can see that what we've done here, for example, this isn't completed, by the way. This is a half completed version just to show you how it might look. But let's say that Ben, who's the practice nurse, we've allocated that for clinical appointments, he has the A and the I. So he must be informed, obviously, because he'll be taking appointments. So he needs to know if there's been any changes or what the model is for managing appointments. And Ben is also accountable for the outcomes and the results. Again, obviously, as a clinician, he'll need to take accountability for any results that come in. But what Ben doesn't necessarily have to be a part of is supporting with the resources for that system. So it's probably not going to be Ben's responsibility to look at what digital system works best for managing appointments, or how the reception staff deal with potentially cancellations or late appointments or shift work or anything like that. So you wouldn't then necessarily put the S in there for Ben. But what you might find when speaking to Ben is that actually he feels that that's what he spends a lot of his time doing. So you can very quickly iron out where people are doing what you understand they should be doing as the manager versus what they understand they're doing as colleagues versus what actually the practice should be doing to run smoothly. So it's quite a useful tool to identify where the gaps are from an understanding and a process perspective. So I won't go through all of those, but hopefully that's just a little insight into how that tool can work for you. And then I think we're on to the hot seat questions. So let's go first with Gary. Gary, it's a bit of a mean question actually to begin with, because it's quite large. But what does good governance mean to you?
Actually, I don't think that's a mean question at all, actually. The first thing I'd say is I think it's poorly understood. I've facilitated sort of whole workshops on improving governance for practices and PCNs, and that always comes across that it's poorly understood. And I also think from my own experience, and my CQC inspector is on the call, and I've actually backed this up as well, that from my own experience is if you see governance as just a barrier to doing your work and achieving what you've got to achieve, then you're probably never going to get to good governance. You're never going to get to that state. It's not a barrier. So you firstly should have clinical and corporate governance. And I think as primary care and general practice, we probably always think about clinical governance. But as a business and organisation, you should have clinical and corporate governance. There's a definition of governance, and I'm going to read it out actually. It's from the Chartered Governance Institute of UK and Ireland. And governance is the system of rules, practices and processes by which the organisation is directed and controlled. So there's what governance is. In terms of the question, what's good governance? For me, it's about when those rules and the processes and how you're working support, and I think that's the crucial word, support you in delivering your services and operating safely, legally, ethically, responsibly, openly and transparently. I think that's what good governance is. And I'd argue it's actually even more. I'd argue that it's also supporting you to deliver and work effectively, inclusively, fairly, to the quality that you need and is required, and to help you learn and develop. So I think if we'll all want that. That's surely what we all want. That's good governance. So if that's truly what you want and you're aiming for, then it's not a barrier. It's supporting you. I think I'm just going to sort of say on bad governance. I think bad governance, and there's probably I was guilty of this. There's probably too much of this about. It is when those conditions aren't met, but also it's when it's overly onerous as well. So that it prevents you achieving all those goals. It prevents you doing the things that you want to do and that you need to for your patients as well. So I think be wary about bad governance and overdoing things as equally as you should be striving for the good governance.
Brilliant. Perfect answer. Have I got an echo, or is it just me? So yeah, I think that's a really good point about the being proportionate. So two things that are really helpful to take away from that is not seeing governance as a barrier. Absolutely. It's always a shame that it's so far down the CQC framework actually, when it's really, if you think about putting it at the top of any business model, any approach that you take and getting it right, then you tend to be on a better footing than if you think about it at the end. And then, absolutely being proportionate. There's nothing worse than too many risk assessments, too many care plans for things that people don't have care needs for, risk assessments for non-existent risks, just in case, thinking about audits that you don't need to do. You absolutely don't need to go overboard with governance. So seeing it as your friend and seeing it as a fundamental building block or the beginning of a well-led service is absolutely the way to go. So yeah, probably for a CQC inspector, if yours is on the call as well, then governance is usually one of our favourite elements to get into. So yeah, thanks, Gary. So Ketan, for a question for you. So at times it can feel as though we are being asked to risk assess everything around us. And that's actually a quote that somebody said to me recently whilst on an inspection. But under the new single assessment framework, the CQC have embedded the word innovative and also proportionate, which is what Gary just touched on. But they've embedded innovative into the quality statements. So can you think of an example of a risk assessment that you or your team have recently introduced that has brought about positive change? Very specific question.
It is a bit specific. I have to think hard about this one. I'm not sure it's necessarily innovative because I'm sure others are doing the same. but it always goes back to communication and how you communicate with people. And there may be changes, for example, medication changes, or certain medications are not prescribed anymore, or there's some kind of major changes within the practice and reception, and you might communicate that via email because that's what you've always done. But you are making the assumption that everybody has read that email and understood that email. Now there are ways around this. You can get people to, you can kind of monitor who's actually read the email, but if they've actually understood the email is something else. And not everybody actually wants to be communicated to in that way. Some people still actually want to read things on paper. So actually you need to account for everybody who's able to access information. So at CQC recently we were asked, or the staff were asked, where certain protocols were. Some actually went online and showed the inspection team, and others went to a folder that was sitting in reception, which needs to be kept up to date. And it just went to show actually that there needs to be an approach for everybody. And just because you've sent it doesn't mean that everybody's understood what it is and where it is.
Brilliant, thanks, Ketan. Yeah, that's really helpful to think about communication across the workforce, and as you said, and I think that was touched on in the reports that we've had a look at earlier, is actually as a manager or as a driver of a particular change, you can think that something's working, but when you speak to the workforce, if there's no evidence of that, then, or if there's differing answers across the workforce, and it's obviously not landed, has it? So it's important to follow that up. Question 3 for Gary. So from a PM or RM perspective, although you need to understand the running of the practice to support good governance, as we've heard of in terms of Regulation 7, you can't do it all. So can you recall or talk us through your approach to delegating work and how you would balance this with maintaining oversight?
Yeah, absolutely. And as the question says, this is just my approach. It's not going to be, the approach that's right for everybody. But I begin by saying that not everybody likes or is good at governance. It's certainly not something that I ever loved. And I think because of that, I wasn't comfortable with it. And I felt that I wasn't good enough at leading it. So I tended to delegate it to people who were better at it. And, going back to what I said, that you should have clinical and corporate governance, I was far more comfortable with the corporate governance. So I probably used to take more of a lead role in that. But I would always go to other people when I wanted to just check that. And I would often use the phrase when I spoke to somebody, I need a compass on this, I need something checked, and it could be one of the partners or maybe the finance manager, assistant practice manager. But I'd get somebody who I knew would give me an honest opinion if I wanted to check it. For clinical governance, I tended to go more to the nursing team, the nurse manager in the nursing team. It tended to be something that they were more comfortable with. So I used to delegate a lot of the clinical governance out to the nursing team and be led by them. But in terms of that oversight, I think you're absolutely right. As a practice manager and all the practice managers and PCM managers, the registered managers, you need that oversight. I used to make sure that when we had our regular meetings, so I'm talking about the partners meetings, the business meetings, the practice meetings, whatever you call them, it's a standing item on the agenda. Think of it as it's important as your finance and your HR and all your strategic areas that you're talking about. And we would talk about compliance, and we would want to know what's happening in terms of compliance, the big things, the small things. So it would be discussed. We were used to discussing it. And in the same way, in the practice, that we would always be looking to improve, whether that was finance or learning and development. How can we improve on compliance? I think as a practice, PCN, or whatever organisational business you are, you should always be trying to improve. So don't leave compliance out of that. How can we improve? So I think, we kept the oversight by making sure it was discussed, making sure it was considered as important as other functions. That's how I did it, and it worked well.
Thanks, Gary. Yeah, that's really important, I think, as well, about your point about putting is just as much importance on maintaining oversight as it is to do the tasks themselves. So an audit in itself is one task, but then almost auditing the audit is equally important from a registered manager or PM perspective. And actually an inspection I've been on in the last couple of weeks where the registered manager is relatively new to post, and they've got a team leader that's also relatively new to post. So they were asking questions about how often who does what audits and how often. Now the CQC can't prescribe a frequency of audits, or there's no set way to do good governance. So what we did is we had a conversation around what felt right for them, and then we started to talk about, okay, you might taper that off in time. So for example, the RM might do monthly checks at the moment, but might over time, when they're more confident with the team leader and the team leader's more confident, is to then reduce that to quarterly. But you could see that just made them feel uncomfortable, and whether or not that's something to do with delegating or being new in post, or actually that's how they see good governance. Once you see that, you think, I said you obviously don't look comfortable, so don't do it. You have to do what makes you feel safe and what makes you feel assured from the running of a practice. So don't stretch yourself in the same way that you shouldn't do too much. Don't do too much, but don't do too little. Find that balance and work with people in your team, as you said, Gary, that enjoy those roles and responsibilities and want to develop in that area. So Ketan, last question for you. So Regulation 17 that we spoke about earlier, good governance, it talks about the importance of a workforce having access to all necessary information. What are some of the common stumbling blocks you have come across in this area, and how have they been resolved?
This is a classic CQC thing, which you realise before an inspection, if you haven't really been prepared properly, where these all come out. So, for example, I alluded to it a little bit earlier, having access to up-to-date policies. A lot of people keep it on the computer, but does everybody have access to that IT? Where is that kept exactly? Some ICBs, have things like TeamsNet, which is accessible for everybody, but you will need paper copies as well, as that's how some people will access them, and it needs to be up to date at each site. When there have been changes, have they been communicated effectively to everybody in the team? And if you have a high staff turnover, that can really be an issue. It can be a difficult job in some parts of primary care. So you find people actually leave quite quickly, find it difficult, and you've got somebody else. They need to be aware of what the policies are, and they need to understand them as well. And that can take time as well. But all of these, I'm sure, affect every single practice as they start to put new processes in place.
Yeah, thanks, Ketan. Yeah, absolutely. It's about making sure that there is one space that is used for a process, and that everybody who needs to have access has access or understands where that is. And it just made me laugh what you said, because, well, I shouldn't laugh, but I was on an inspection recently again where there were three, when we went to look at policies and procedures, there were 3 folders in the shared drive, one called 2024 policies, one called new 2024 policies, and one called 2024 policies #1. So where the most up-to-date policies are, it turns out nobody knew, and they were all looking in the different folders at various times throughout their working week. So, and actually, the person who was responsible for policies had actually been putting them somewhere completely different, and then staff had been dragging them into those 3 folders. So it was a minefield, and as we would say, probably requires improvement in well-led for this particular quality statement. So yeah, making sure that you have a consistent and known approach it sounds simple, but I'm sure some of you will be thinking about your shared drives right now and thinking they could probably do with a little bit of TLC. So it's worth putting the time in for that. All right, thanks everybody for that. Thanks, Gary and Ketan, and we will now hand over to Claire to talk about the well-led practice.
Thank you, Gabby. Loads of insights there. I was frantically writing down little kind of snippets. I think the highlights for me have been just how much governance sort of underpins everything, and not just everything in well-led, but everything in all of the other key questions that the CQC inspect under. And what we often find when we're supporting practices is it starts right at that roles and responsibilities thing. And if that's not quite right, then it's like a kind of house of cards. You can't really build anything from it if you're not clear about who's doing what and why, and who they're accountable to, and what they're responsible for. So that's a good place to start, I think, with that RASCI matrix. You mentioned, I think it was you, Gary, or perhaps it was Gabby, about the CGI the Governance Institute. They're amazing, and I've registered with them for free, and they're always sending me loads of useful, interesting resources and webinars to join, so you can learn about things like how to run effective meetings, particularly useful for any PCN colleagues on the call. So I'd recommend registering with them, and they send out a lovely newsletter every so often. Didn't quite understand how much the CQC love a team meeting, particularly a team meeting that's minted. So we definitely need to be doing as many of those as we can. And I also noticed that there were 90% of practices last month that were requires improvement or inadequate, which is really, really shocking and sad to see, and probably scary for a lot of people on the call who are from primary care. But hopefully we can help a little bit, although I'm sure Gabby's webinar so far has been really helpful and allayed some concerns about what we need to be doing. But in terms of what the well-led provider can offer, well, we don't get much leadership training. As I just mentioned, the CQC is rating us inadequate or requires improvement quite a lot at the moment. That statistic is already out of date, and I only took it a few days ago. We also now know that the CQC say that you absolutely must seek feedback from your staff, in whatever organisation you run, and that you must act upon that feedback. The other kind of gap that we've identified, and the ethos behind why we built this well-led provider platform, is that it only tends to be the most senior people in organisations that get access to some sort of leadership development. And that's not really how it should be. We should all have access to that sort of thing. We all need to be as effective as we can as team players, even if we have no potential, maybe we have no ambitions at all to be leaders, but we should still be getting access to something. But in the majority of our organisations, people are recruited from within, and our leaders of the future are starting off in junior roles. So we need to be providing some sort of support to everybody. And we know just how much leadership plays into everything else in our organisations. And if we get it right, then we're on top of things in terms of staff recruitment and retention, sickness, and our patients or our service users ultimately benefit because everybody's more productive and effective in what they're doing. So what our platform does is it gives some team development and leadership development for absolutely everybody in your organisation. And it was created by us, so GPs, practice managers, CQC experts, facilitators. One of the things that the software will do is seek that feedback that you're required to seek on your behalf from your staff anonymously. And that feedback will also then cover all of the CQC well-led quality statements. So you can use your feedback report, not just as a useful way of gathering feedback from your staff about how you're doing, but also to demonstrate some evidence to the CQC that you are indeed well-led. For example, that your staff feel that they are fully aware of their roles and responsibilities. The platform can also complement whatever you're doing in terms of annual appraisal, because it gives you the opportunity to do 360 reviews for everyone in your practice, whether that's somebody in a leadership or line management role or not. And the platform also allows you to compare your results with results of similar organisations, if you so wish, so you can see how you're doing. And that information isn't shared with anyone else unless you specifically choose to share it. So it's sort of safe benchmarking to be useful and supportive, rather than for anyone to use you with a performance management stick over. If you were to create one of our practice or organisation well-led reviews, then your staff members will get sent a link to fill in a very simple, quick, anonymous survey, if you like, against all of those well-led criteria and everything that we know you need to be doing as a well-run organisation. And then you will get a breakdown of your data, and you will get we will signpost you to the areas that we think you need to be working on. We'll also signpost you to the areas that your staff have specifically said you need to be working on, in case those are different. And then you can use our library of expert guidance and exercises to then get on and make changes and improvements in those areas that you want to, and thereby demonstrating to the CQC that you've sought feedback, you're acting on it, you've done a specific thing, and then you can review how you felt about doing that thing and do another review and hopefully demonstrate that you've made some progress, which is exactly the kind of cycle that the CQC want you to be going through when it comes to your staff and being well led. So some of the questions that we ask specific to this governance management and sustainability quality statement are things like, are you clear about who your line manager is? Are you confident about what your job description is? Have you got good processes? Do you feel for sharing information internally and externally? Are you made aware of any learning points and outcomes from mistakes and significant events? These are the kind of questions that a CQC inspector will be asking your staff anyway, so might as well get ahead and ask them yourselves. Is the practice appropriately performance managing people? Are team meetings good, effective, clear? And are people making decisions based on evidence and views of users, patients and staff rather than just on a whim or by opinion? And then we have some resources that you can choose to do, some exercises, such as that one Gabby alluded to about using that RASCI matrix to make sure you've got all of the roles and responsibilities right. We've got an exercise to help you set actual performance measures and review progress once you've set your objectives. We've got an exercise to help you make the best decision when it comes to what you'd like to do in the future as a practice, making sure you're involving the whole team in that. And we've got an exercise about reviewing in general the effectiveness of your meetings and the role of the person chairing and how effective that person is being. So that's the sort of resources we've got on there. These are our prices for GP surgeries and PCNs, because that's the majority of our attendees today. But please let me know if you'd like information and you're from another sector. Our prices are based on list size, and when you buy our product, you get access to the software for a whole year, so you can do as many of those organisation level well-led reviews as you want, as many individual reviews as you want, ideally for everyone during their appraisal, and you get unlimited access to that library of expert guidance and exercises. And then there are some action logs and reflective logs that you can populate and download all of those so that you can then present them as evidence to the CQC. If you buy it at a PCN level, then you get access for all of your practices, and we throw in access to our PCN platform for your PCN team itself, because lots of PCN teams need support with similar things to practices, and indeed some are regulated by the CQC now as well, as they're beginning to become incorporated. It also recently just launched the option for you to buy a one-off well-led review of your organisation if you're worried about the threat of an imminent CQC inspection and you would like to be able to tick the evidence box of saying that you've sought feedback from your staff against all of those well-led criteria. So do let us know if you'd like to buy that from us. And anyone who is a customer of MyAB, or otherwise known as Lloyd & White, that's an insurance broker that a lot of practices use, you will get 10% off all of our products. You just need to let us know at the time. You will get these slides, so I won't dwell on them too much, but if you want to have a feel for what it feels like for one of your staff members to do one of our feedback gathering surveys, then you can use this QR code and it'll give you the option to have a little play around, and you'll get a free resource, a free exercise at the end of it based on how you've sort of scored yourself. And we'd be very grateful for any feedback from these webinars as per usual. You can also ask some questions on that feedback form if you don't feel able to ask the questions in front of the audience today on the webinar. But we do take it all seriously, and we have a good look at the feedback afterwards, and we try and make changes for the subsequent ones. So I will just see if there's been any questions. I'm wondering if there haven't been any at all, which is unusual. Would anybody like to ask a question while you've got the panel here? Silence. Okay. Well, it's 5 minutes to 2, so you can have 5 minutes back of your lives. As I said at the beginning, we will be sending the recording and the slide deck information to you in a few days' time, so you can have a reread and a rewatch of everything. But please do reach out if you'd like to ask us any questions. And we are having a break over the summer from these webinars, although we're still around. So the next one will be in September, and you'll get invited to that probably towards the beginning of September. I'm just seeing something pop up in the chat, which is Stephanie. Yeah, it is quite shocking how many practices are doing so poorly on inspections. It's definitely, I don't know what that's a reflection of. Are they ramping up the compliance dial, or are we all just struggling at the moment because we've got so much else on? Gabby, do you have any thoughts about why the numbers are looking so bad?
I think what's important to remember is that under the new framework, they're not doing comprehensive inspections as we used to call them. So unless you're a newly registered service, you won't have all 34 quality statements inspected. So those scores that we're giving you, it can be somewhat misleading when you go onto the CQC website and have a look at the data, because they might have had a requires improvement score in only a handful of quality statements, or only a particular number of quality statements, which isn't necessarily reflective of the whole service. They might not, for example, have looked at caring or effective as key questions at all. They might have only looked at, 2 or 3 from well-led, or 2 or 3 from responsive and safe. So I do think it's worth going into having a look yourself at some of the reports and understanding what the new framework looks like in terms of the ratings and inspection point of view. It's not everything about the service requires improvement or inadequate anymore. It's snapshots under the particular quality statement. So yeah, a little bit proportionate. A proportionate approach is probably required there.
I know, am I right in thinking that the well-led one tends to be one that gets targeted in these focused ones, perhaps more than other domains?
Yes, yeah, safe and well-led.
Safe and well-led, there we are. So if anything, that's the ones that you need to be concentrating on. Gabby does, through the well-led provider, offer a mock inspection service where I say Gabby will come in and do a whole 2-day inspection against all of the single assessment framework. But we could do a targeted one for people who feel that they just need a bit of support with 1 or 2 particular key questions or quality statements, couldn't we, Gabby?
Yeah, absolutely. Yeah.
Right. And one other comment in the chat again, Stephanie. I was expected in person in December 22 and still have PTSD. I live in fear, grateful for any help. I miss the Nigel surgery CQC used to do. Yeah, those kind of myth busters. I'm sorry you had such an awful experience with your CQC inspection, and that's sadly one that we do hear people talking about. But I'm glad that we've helped a little bit. Of course, we can't tell you exactly what to do because the CQC don't tell you exactly what to do, but we can try and help as much as we can. And I think providing evidence of what other people have provided, which has either hit the bar or missed it, helps you to know what you need to be doing. And Ali, I know you're a CQC inspector as well, or a former CQC inspector, so thank you for your comment. CQC are inspecting according to risk. So more identified risk may result in more inspections where a risk is a factor. So that might be why the numbers are so bad, because perhaps the CQC are targeting the riskiest practices. I hadn't thought about it like that. Thank you, Ali. Brilliant. Well, thank you for tuning in to everyone who's on the call, and thank you for all your interesting and insightful comments. And we will see you soon, but please do reach out if you need to. Take care, everyone.
Thanks, everyone.
Bye.